Taoiseach, seeing as you're not busy with any particular legislation at the moment, as you suggested in your answer, can I suggest something for your department to do, given that you're responsible for coordinating the response to COVID? I mean, there are many aspects to it, but one that is glaring us in the face and is more evident with every day and will certainly be the key to any kind of return to normality is to have more doctors, more nurses, more healthcare assistants in order to increase the capacity of our health service. One thing that I was shocked to discover at a meeting of the student nurses, who, by the way, you suggested on October the 20th should have the pay they received in March and April returned to them, but Minister Donnelly is not doing it. But another thing that is absolutely scandalous, and I really think legislation would be a good idea on this, is a huge obstacle to the recruitment of nurses, sufficient nurses and doctors, is the level of fees that they're being forced to pay. Student nurses working on the wards in the front line paying €3,000 in fees. Mature student nurses paying $7,500, and then another group I met recently are graduate entry medical students training to be doctors paying €15,000 a year in fees. And as all of them said, we can barely hang on. We can barely hang on. So there's an active disincentive, financial disincentive, to actually get the trained doctors, nurses and midwives that now more than ever we need. You should be doing something about that, right? That is crazy, to put financial obstacles in the way of training up the frontline healthcare professionals that we need, and actually putting them through the ringer financially in terms of trying to complete their training.
Thank you, Deputy.
Deputy Boyd Barrett raised the issue in terms of recruitment of nurses and doctors. And just say to Deputy, I introduced the nursing degree programme when I was Minister for Health. At the time, it represented a very radical transformation of nurse education. And I put enormous resources in behind it to create the new facilities that we have in universities and in institutes of technology across the country. And those changes were informed by nurses, by the nursing union, but also within the department at the time. We brought in nursing personnel who headed up the nursing unit and who engineered the proposals around this dramatic reform, which meant that students came away from the apprenticeship model that was within the hospitals and applied as students to third level. And that changed the model entirely at the time in terms of payments and so on like that. And that was signed up to by the INMO at the time and by all the parties concerned. And we transformed postgraduate nurse education and created far more opportunities for nursing in that regard. Now, I understand things move on and advances are made, but that should be acknowledged. Enormous investment went into that. And most people didn't think it could happen, but it did under my watch happen at that time. And in response to the issue about the current situation, that's been in negotiations between the HSE and the INMO in the appropriate fora for quite some time now. I wish it was brought to a conclusion, but I think the various asks have been made and demands, and it's part of the industrial relations process now, and it has to be resolved through that process. And in terms of the postgraduate medical programme, that in itself was an innovation as well, which was sought for at the time, that people would be given an opportunity to pursue medicine. I do acknowledge your point that it is expensive, but actually as a programme it has been effective for many. It has been effective for many people who had previously been debarred from going down the medical route, but who now can access
Thank you, Taoiseach. We have to move to question 4 now.
And it has been effective.